During this COVID-19 pandemic, we've been joined by medical professionals answering your questions live. All you have to do is text your question to the number on your screen. That's 479-785-5055. Our guest this afternoon is Dr. Lance Faddis. He's a pediatrician with Mercy. Doctor, thanks for being with us. We want to start with an elementary student from Rogers School District tested positive for COVID-19. We learned that this week. That diagnosis was within the 14 days of that student being around other kids and school staff. Now, we know you can't comment on a specific patient, but we do have some general questions. The first one is, what should parents do if they feel like their child was exposed to an infected student?
Well, I think, first of all, one of the things to think about is really not to panic about that. In general purposes, children will do very well with this virus compared to adult population. So I think if your child was exposed and would happen to get coronavirus, the likelihood is they will do very well with it. One of the things to think about, if your child has some type of a condition, asthma or other comorbid conditions, those children may have some issues, but for the most part, children do very well with the virus.
Well, that's definitely good news. Talk about symptoms. What symptoms should parents be looking for, and can they differ between children versus the three standard symptoms we've been talking about for adults?
There are some studies that looked at kids and symptoms of coronavirus, and they found that GI symptoms were probably a little more prominent in kids than they were in adults. So that's something to think about. Diarrhea, nausea, vomiting, those kind of things might be a little more prominent in the pediatric population, or at least you might see them a little more regularly there. But for the most part, fever is going to be a very good sign. However, there are a lot of kids, many kids, that will not exhibit any symptoms at all. They'll be essentially an asymptomatic carrier, and that's one of the reasons we think about the way we interact with these kids and the social distancing is they have a potential to be an asymptomatic carrier and really have no symptoms from the virus.
For kids that do end up getting sick, I know there's a number, more than a dozen in the state of Arkansas right now who have COVID-19. Does it tend to be more dangerous for them than it is for adults if they do start to show those symptoms and get sick?
It's still going to be less severe for a child than an adult as a general rule. However, when you have other conditions, some of that can be, subject. So as a general rule, better for kids unless you have a comorbid condition.
Talk about the treatment protocol. How do you keep kids healthy and get them healthy again if they've tested positive for COVID-19?
For the most part, it's a symptomatic therapy. There are certainly some studies that are out there that are looking at different medications and how those might be used in order to treat the coronavirus. But there is really nothing out there as of yet that has very strong proof from a treatment standpoint other than just symptomatic management, Tylenol, plenty of fluids, plenty of rest, those types of things, very much the same way you would with a cold or flu. However, the big thing is we don't want you to catch it. So practice the social distancing, washing your hands, those types of things in order to stay healthy.
As a pediatrician, what's some of the most common questions you've been getting from parents over the last few weeks since the coronavirus outbreak has started?
It has mostly to do with that. How can we keep from getting it? What should we do if we get it? Those are the kind of things that I'm hearing, and everybody's concerned about it. I mean, the news is very scary related to this virus, but I do think for parents, for the most part, we don't have a whole lot to fear with this virus for kids.
That's definitely a silver lining. Thanks for answering those questions. We'll have more questions for you coming up after this break. First, though, let's get a look at your forecast. We are back now with our guest today, Dr. Lance Faddis. He's a pediatrician with Mercy Hospital, taking your questions about the COVID-19 pandemic. I know, Doctor, as many parents do, I'm sure, my husband and I have been going through all the what-ifs and trying to prepare for if or when our children get sick. And so I know a lot of parents are wondering, if their child were to get sick, how do you self-quarantine one of those children away from other family members? Should one parent be responsible for caring for that ill child and the other stay away? How do you help families and walk them through that process?
That's generally best practice. If you can have one parent be the primary caregiver in those types of situations, if you can isolate them sort of away from the rest of the family in a bedroom that's distant. If you can have a fresh air supply in there, open the windows on these nice days, that always helps as well, just to decrease the viral load inside of that room. This is passed via droplets, so it can be droplets in secretions from the upper respiratory tract, when you cough, when you sneeze, when you blow your nose, those types of things. It can also, again, in kids, GI symptoms can be a big part of this. So if you can also separate them into their own bathroom in those instances, that's a good idea as well, because they may be passing the virus in their stool as well. So, and then just cleaning fairly frequently with those. Again, the caregiver needs to make sure they're washing their hands on a regular basis, having the child wash their hands. If they blow their nose, they need to sanitize their hands afterwards. So just moving through that process and thinking about every time somebody sneezes, somebody coughs, somebody blows their nose, somebody goes to the bathroom, they may be shedding that virus.
Good advice there. I know you mentioned earlier the impact of social distancing and why that's so important. How do you explain why social distancing is important and how to do it properly to your kids?
Yeah, I think the exact how and why may be a little difficult for kids to really wrap their brain around, but I think you can explain that to them in an age-appropriate way. I think all kids, like games, and so that's sometimes a good way to think about it, make a game out of it. I think it's also good to have them be a part of the protector. So kids want to be a part of that as well. So when you explain to them that what they're doing protects other people in their community, most kids will identify with that.
And that way they can help too and be part of the solution, right?
Absolutely, absolutely.
Should we be keeping kids away from their grandparents? That's a question we've gotten from a lot of viewers. How do you address that?
That's a very difficult family decision, I think, but knowing what we know, knowing that children very many times can be asymptomatic carriers, I think it's something that you really have to evaluate, particularly if your parents have some type of comorbid condition. If they smoke, if they have COPD, if they have diabetes, if they have a heart condition, if they're immunosuppressed in some way, shape, or form. Those types of folks, definitely age is a factor, but those other comorbid conditions make a significantly higher increased risk of complications.
So in general, those social distancing protocols are important to follow, whether someone is family or friends, if they're not living in your household. Is that correct?
Yes, ma'am.
Okay. So we got a question from a viewer saying, my children attend speech, occupational, and physical therapy. Should I still let my child go to their therapy center?
Well, I would say that some of that is going to depend on the other comorbid conditions of the child. Again, so if the child has significant other comorbid conditions, you may want to weigh the risk versus benefit of being out of therapy for some time. I would also encourage you to contact the people that are providing those therapies, because many times they are making adjustments and maybe they're changing the way they bring patients into their environment. So it's definitely a difficult consideration, but the comorbid conditions play a big role in what I might use to decide that.
Gotcha. All right, that makes sense. We appreciate the insight here. We're going to get to more questions from you coming up in just a minute. We'll have those coming up after the break. Back now with Dr. Lance Faddis. He's a pediatrician with Mercy Hospital, answering your questions about coronavirus and the impact it's having on our children. I know one question that a lot of people have asked us is, what should parents be doing about scheduled well visits and those benchmark vaccines for younger children?
So most offices are making adjustments in that process. Many offices are trying to schedule well visits at a particular time and sick visits at another time. And so many of the offices across the state are making adjustments in that process, trying to keep kids on track as much as we can, knowing that in this pandemic we are going to have some times when that's not able to happen. So I would just check with your primary care provider about that.
Is it safe, though, and okay to reschedule if parents desire?
We like to keep them on track as much as we can, and so that's why I really think it's important to be having that conversation with your primary care provider and seeing what they're doing. And if they have a process in place that works out, I think it's wise to go ahead and follow that.
Okay. How do you talk to your kids about the risks of COVID-19?
I think it's always important to be age appropriate with children. Older children have a great deal more that they can grasp about this, and you don't want to be big and scary to little kids about this. The process that this virus takes is scary, and it's for a lot of people, it's a very scary disease. So I think just being honest with them and talking them through that and trying to hear them and what they've heard, because many times they've heard things on the news or other places, and so they may have some kind of fears that they're not even really talking about. So making sure that you're communicating with them and helping them through what they understand.
Gotcha. We got a question from someone asking, is it safe to go outside and play? Have your kids go outside during this time? What do you say to that?
Absolutely. I think that's one of the best things you can do is get outside.
Keeping social distancing in mind, though, correct?
Yes, ma'am. Yes,
Okay.
ma'am.
We know that schools are closed, K through 12 schools right now, but daycares are still open. Is there a concern about the safety and the health of children that are all in daycare centers together?
Well, again, for the most part, kids are going to be okay with this virus, and so I think that is one thing. But all these places are mandated to be taking temperatures when kids come into their daycare, so they should be monitoring those children. And I'm sure most of those places are doing that appropriately. But if you're dropping your kids off, you need to be thinking about that. Are they checking temperatures? Are they doing the screening that they're supposed to be doing when you drop the kids off? And then how does that happen?
And just quickly, what should parents do if they think their child may have COVID-19?
First off, stay home. That's the main thing. Don't be out spreading the virus. If you think you might have it, stay home. Be considerate of others in that regard. And then contact your primary care provider. They can help direct you and give you advice on how and what you need to do. For the most part, since we have such a limited number of tests available to us, we may not be testing kids that are relatively asymptomatic, even though we think they may have the virus. So we have to weigh all those things before we do a bunch of testing.
All right. Thank you for the reassurance. We appreciate it. We're going to leave you with the final word after this break. Stay with us. Throughout the COVID-19 pandemic, we've been welcoming medical professionals to answer your questions about the coronavirus. If you have a question you'd like answered, you can text it to the number on your screen, 479-785-5055. This afternoon, we're joined by Dr. Randall Staley. He's an adult, child, and adolescent psychiatrist with MANA in Northwest Arkansas. Doctor, thanks for being with us.
Thank you, Erica.
So in dealing with this pandemic, we've talked a lot about the physical issues that people are coping with, but what are some of the major mental health issues that doctors are seeing during this COVID-19 pandemic?
Well, right now, a lot of the mental health issues that we're dealing with in the clinic right now revolve around anxiety and fear. Beginning to see a little bit of increase in depression recently, but it's not been as much. I do expect that to increase more as we see a longer period of social distancing.
Obviously, you work with patients who have been diagnosed with those issues, but how do people at home, even if they don't have a diagnosis of anxiety or depression, cope with the anxiety created by all the unknowns in our world right now?
Well, my first recommendation for anyone who's dealing with anxiety is to stick with your schedule. You know, our body knows what our schedule is, and doing something that is familiar to our body is going to help reduce that anxiety. That means getting up at our normal times, eating at our normal times, and also going to bed at our normal times. If you're working from home, do your best to keep your work schedule normal, at least the working hours that you're doing.
Sure.
We've got to create connection with people while we're social distancing. So I'm recommending that people use social media or teleconferencing services to plan fun events such as a virtual dinner party, or, you know, just have a good old conversation. Reaching out to others kind of gives us that sense that we're not alone in this. And finally, you know, stay connected with your faith. Make sure you're getting exercise and plenty of activity.
I love those ideas. Talk about some of the mental health concerns for families who are all cooped up together during these times of social distancing.
You know, right now I'm seeing a lot of increase in issues with anger and irritability within families. What seems to happen is that we get all these individuals stuck in one location and we don't get a break. So my recommendation is take a little bit of a break from one another. Have a little bit of alone time. Go do something just for yourselves in another room. Just be careful not to isolate all the time. That actually will worsen the depression and the anxiety.
What about for those who are
kids, I would say try to find a second adult or elder sibling if possible to watch them while the other adult kind of gets a bit of a break.
Yeah.
And also don't forget about the kids. You want to not let them feel like a burden, so you want to include them in your conversations and planning.
What about for people who are home alone and individual? What do they have to do?
You know, you want them to, again, schedule their time with their family and their friends, connect electronically. There's a lot of local classes that are happening right now online, such as exercise classes, art classes, theater classes, and many more. I would recommend that everyone takes advantage of this time and these resources while we can.
Sure. Talk about some of the mental exercises that people can do while at home in self-isolation to keep that mental health strong. What are easy things they can do?
It's not just doing mental exercises. Some of the mental exercise that you get is just by going out in your yard or around the neighborhood and take a walk or a bike ride. Just make sure you're keeping your 6-foot separation rules whenever we're kind of doing this. Things for your mind. I recommend a lot of the mindfulness meditation type apps like Headspace, Calm, Aura, and other things in that respect.
Good advice there. We appreciate it. We'll have more viewer questions for you coming up after the break. Don't go anywhere.
Thank you.
Back now answering your questions with Dr. Randall Staley, a psychiatrist here in Northwest Arkansas. Doctor, one of the questions we have for you is the impact on the mental health of those who are on the front lines of fighting this disease, fighting it physically, healthcare workers and many other people. How do they cope, and will they deal with some sort of PTSD after all this is over?
For those individuals that are in these kind of vital and essential roles out there, they are kind of at a heightened risk for both acute stress and post-traumatic stress disorders. Those are already beginning to come through in the clinic already that I'm seeing. My recommendations to try to minimize that, though, are for these people who are out there to be open and honest with their family and their friends and also their coworkers and bosses about what kind of stress and anxiety are they feeling. When we're able to openly share about our fears, we're better able to kind of decompress and kind of work through it. I also am recommending that they kind of start looking for some kind of hobby that they enjoy and getting, again, enough exercise and rest.
Yeah, a good way to decompress. Just quickly, are mental health services covered by insurance? And at this point with social distancing, are they available through telemedicine?
Currently, there are mental health services that are available both through insurances and telehealth, telemedicine services. What services that are particularly available depend on the specific provider and also the insurance company. Right now, MANA in Northwest Arkansas are using telemedicine services, and I know that there's many of my colleagues, both therapists and psychiatrists, that are also using these options. It's been really helpful that the governor has opened up the use of telemedicine and relaxed some of the rules surrounding it.
That makes a big difference, especially with this time. We'll have a final thought with you after the break. Stay with us.